We brought in a doctor to answer your COVID-19 questions. We're going to check back in with Dr. Frank LoVecchio. Good morning, doctor. Our first viewer question this morning comes from Corky in Litchfield Park, who says, is the COVID vaccine good for a year like the flu vaccine, or is it a one and done situation?
It's a great question. We get it all the time, but the short answer is we don't know. The disease has only been out for about a year now, coming up on a year. It seems like it's going to be revaccinated every few years at least. You're probably not going to get lifelong immunity, so probably more than every year.
All right, interesting. Our second question this half hour is from Laura. She asked, are some of the adverse effects of the vaccine heart attack, stroke, and death? And if those ones aren't it, what are the adverse effects?
You know, we don't seem to be seeing strokes, heart attacks yet, but remember, only about 40,000 patients received the vaccine in the largest trial to date. We do see heart attacks, strokes, and blood clots all the time in patients with COVID-19 patients. So maybe that's where that's coming from, but not from the vaccine so far. Things are different once you open it up to, hundreds of thousands of people or millions of people. We might see some of that, but so far we haven't seen that. The main side effect that we're seeing is about 10% of people say, especially on the second dose, they feel like they got hit by a bus, meaning that their body aches, their joints aches, they have a fever, they feel tired. I expect that a lot of people are going to call in sick, after the second dose to work, because it's hard to differentiate that from the flu or another viral infection. And quite frankly, they don't feel great.
So our third viewer question this morning is from Lisa in Central Phoenix, and she says, if you've had COVID, can you be a carrier and pass it on to someone?
We believe not. And the short answer to that is that about a handful of people have gotten it twice, and more likely than not, they could have spread it. But other than that, it's very, very uncommon for that. After about 10 days after you recover, it's very unlikely that you're giving it to anyone else.
Well, Dr. LoVecchio, we appreciate it. Stand by. He's going to stay with us throughout the morning. Continue to text us your questions. 602-444-1212. We'll get to as many as we can this morning.